Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Punjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now, I'll ask Lindsay Ascott, that is Director of Primary Care, Ministry of Health. I'll share a video with you. She's not here with us during this program, but she sent a video. She's a Director of Primary Care Quality within the Primary Care Division of Ministry of Health. Now I wish to play that video.
Thank you for the opportunity to provide opening remarks at today's Healthy Living, Healthy Heart Forum. I'm Lindsay Arscott, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer my respect and my gratitude to the Lekwungen peoples on whose traditional territory I am located on in Saanich, and to the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Chartered community located in Victoria. Patients as Partners believes that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. This philosophy is summarized by the motto, "Nothing about me without me." Patients as Partners has collaborated and funded iCON for over 10 years, with Dr. Kendall Ho as the executive director for all of that time. iCON continues to bring healthcare providers together to speak with people in their first languages about topics they have asked to learn more about. And today, that is about heart disease. Cardiac Services BC states that heart disease is one of the leading causes of death in Canada. However, they also state that about 90% of premature heart disease can be prevented with good health practices. Today's presenters will discuss what heart disease is, how to prevent heart disease, and most importantly, how to live well with heart disease. Resources will be provided that can empower you and your family to optimize your health. The encouragement and support from working together as a family and in the community can make it easier to make these health changes. I want to thank iCON for bringing us together today, and I invite you to check out the resources after this discussion. You will find information on heart disease and other health topics, as well as websites where you can enroll in self-management, health coaching, and other peer support programs. These programs provide information, skills, and support to help you achieve your health goals. I want to express a big thank you to iCON and our presenters today and tomorrow. I appreciate your time and want to thank everyone for attending. What you do for your health can make a big difference. Thank you.
Proceeding ahead, I will present Vaneet Kaur on the stage, who is a registered dietitian. She completed all her education, University of British Columbia and Manitoba University. Vaneet uh, will present her viewpoint about the diet, that it shouldn't be only tasty but healthy. I have eaten her food prepared by her. The diet is not only tasty but also healthy. So, Vaneet, come to the stage. Thank you, everyone. Hello, everyone. I am Vaneet Kaur. I'm a registered dietitian. I hope your interest in healthy diet, it should be more than just the clapping. I I was brought up in a Punjabi family. My family was in Punjab before, and in last 20 years, we are residing in Canada now. And during that time, we in our lifestyle, we made changes in our lifestyle and diet, and we have not a very good diet over there. I understand all that. That's why I I went into neuroscience education. We have so much scientific evidence and information why we have so many illnesses in our community after. So I studied in nutrition after that because I was curious about this. So uh, towards diet, I used to hear maybe the Punjabi diet is not for our health, whether it's good for our health or not. So there was a lot of confusion on that, for myself in our community. So that's why it's ve- it's my pleasure today. So we all are together here. So we are talking about Punjabi heart health today to discuss about that. So today we will learn today. The learning objectives are How can eating better improve our heart health? Tips for preparing heart healthy food, how to buy heart healthy groceries on a budget, and in the last, when we go to the events, weddings over there, how we can maintain heart healthy diet over there, and we will talk about that later. So there is no doubt in that for a healthy and eating a healthy and balanced diet is one of the most important things. So when we talk about that, a, he- a healthy diet, what is the purpose? What was the effect? The diet should improve our cholesterol, improve our blood pressure, improve our blood sugar. So the we know how important heart is to our body because it's a pump since our birth to our death, that always pumping our blood to each and every organ and cell in our body. If that there is a change in that blood, if it's thickened, so or our blood vessels narrow down, then load and affect it will affect our heart. That's why we know the illness we talked about this morning. If we want to lessen the load on our heart and we want a healthy diet and how it affects our blood is very important topic. So these three things we will proceed. In Canada, there is a model that's prepared about the balanced diet, and we say it Canada Food Guide. We call it Canada Food Guide, and there are directions there that we can in our lifestyle. So we just can look at our plate and it can direct us the plate or our diet. Is it balanced? And why it's not balanced? What are the causes and how we can make it balanced? It's a very powerful model. So we will talk about that model. The first direction is the plate you have. Even if you are eating food or snack, try half a plate with every meal should be full with the vegetable and fruits. And then people say me we only eat lentils and bread. So where can we bring the half plate? You try whatever you are eating right now. So we should add fruit and vegetables in that. You can add coriander, cucumber, um, lemon, fenugreek, spinach, and we can put it in yogurt, and we can have chutney. You can is easily add can be added to the Punjabi food. It's easy. The second thing, when we buy these things, because half a plate is a lot of fruits and vegetables, just seasonal fruits and vegetables we should buy, because we can buy if you go to Punjab, you will get spinach, carrots, cauliflower. We eat seasonal. Yeah, so we should eat seasonal fruits, food. It's easier. And the second thing is frozen fruit and vegetables we can buy here. They have the same type of nutrition, carrots, cauliflower. So, but just be careful that they shouldn't have more salt and sugar, and they shouldn't be filled with more sugar, and they're cheaper, and we can always freeze them. And if we don't have a fresh vegetable, we can use the frozen one at that time. But you should be careful. Canned vegetables, canned spinach, sometime um, we buy frozen canned, so we should avoid that because they will make our diet unbalanced. Dried vegetables and fruit like dates, um, raisins, we can make our diet nutritious. The second thing from Canadian Food Guide is about greens. So we came from Punjab. We we are familiar with green. That's what we got it from beginning in India because of colonization, and since we came here, the variety we used to eat, we used to eat millet, corn, bread, not only wheat, whatever things were grown up there, then we were used to eat them. So because of that reason, grains, the the because that takes long to ripe, we consider them healthy. We can bring those grains in our diet, and we should try when we cook this grain. We should only use water. If we use oil, butter, or salt, then our diet becomes unbalanced. The third thing is protein. So because of in our diet, we use plant-based protein. There is lot of is present in abundance and is tasty. Like we have chickpeas, kidney beans, and because it has lot of fiber, and cholesterol and fat is not present, so it helps to manage our cholesterol. These lentils and vegetable in our international from it's out of Punjabi cuisine and became international cuisine. It's usually present in our diet. So you can make lentil soup. You can make salad with the black peas. You can add onions, coriander. You can enjoy, or you can roast them. You can make it a snack by roasting them. You can add it in the flour, and you can eat it that way. The fourth direction for a healthy diet, we will talk about fats. There are two type of fats. There is unsaturated fat that is that may improve our heart health. If you wanna recognize these kind of fats, anything that's liquid at the room temperature. So it's all oils. It's the oil coming from nuts, avocado, peanut, walnut, almonds, cashew, and oil from and the fish oil. So it's very good for the heart health. Just be careful whenever you buy nuts. It should they should be unsalted and unsweetened. If you buy peanuts, no, they shouldn't be salted and they should be roasted. So the biggest thing here is when we use oil to fry. So there are a lot of types of oils in the market. I usually hear here I most the most of the time the question comes which oil we should use, Vaneet. You can ask me question answer at the end, but we don't have time. If we wanna keep in mind, if you fry something in once in that oil, don't use that oil again, because when you do that, there is a lot of trans fats in that oil, that are very risky for us. Can Health Canada banned that oil to use in factories and restaurants. So we have to be careful. If we fry something at home, and then don't use that oil again. Now we are talking about a balance in diet. So in your mind, you can think about the balance in your mind, whatever we talked about today. Like half plate should be and the vegetables and fruits, and then plant-based fat and plant-based protein, and then these things lack in our Punjabi diet. So we should add these things to our diet and balance it. Sometimes in our diet, these are the things that are present more in our diet. We're not going to cut it down, but we're going to only lessen it in our diet to make it healthy and balanced. So we will talk about that now, that we should, the one we're going to reduce it from our plate, saturated fats. So how we recognize saturated fats. These are the things, they are fatty meats, right? Or in our dairy, in our milk. So don't use um, milk that's 2% more than in fat, like butter, buttermilk, cream, paneer, and cheese. So we have to be careful while using it. So maybe once or twice in a week. So we should use it very less in a. The second thing is the oils. The even some oils are even fluid on the room temperature. They have rich in saturated fat. It's coconut oil or some in canned. So coconut oil has a lot of saturated fat in it. So that's not good for our health. So don't use processed foods. So avoid them and be careful while buying, and look at the label how many ingredients in there, and just use plant-based protein, and we have to ensure how if they don't have how much unsaturated fat in there. The other thing we wanna limit the intake is salt. So the directions we should take from the Canada Food Guide, maybe in a whole day we can only have one teaspoon of salt. So we can abide by it if we is cook at home, but if we buy food from outside or canned food, then the amount of sodium is very big on that. So we have to be careful and avoid all these things. We should read the labels. And the last thing is sugar intake. We already heard how it affects our heart. So we have to be very careful whenever we are buying something. It's already made, pre-made thing. There is a lot of sugar in those things. So please read your labels and then see how much sugar is present in that. And secondly, we think juice is very healthy for us, but if you wanna eat fruit, eat the whole fruit instead of drinking juice, and even eat cereals with lower amounts of sugar. There is a lot of sugar in the cereals, so be careful when you are eating cereals. So we talk a lot, so we don't have enough time. So and the key points are in our Punjabi diet. Yeah, how we can make it balanced. First of all, we should eat more fruits and vegetables, cook meals at home, and it's very good for heart health. And the third is avoid processed and pre-packaged food. So quickly, so we will be talking about the directions. If you are dining out, if you are eating the food that's already cooked for you, how you can be careful about that. So healthy plate model we talked about if you are going on an event or wedding, or so there's a very good opportunity for us over and just fill up your plate with the vegetables and fruit or roasted, so stuff which doesn't have too much oil in it, and 1/4 you you choose a meat or fish paneer which is roasted in a tandoor or grilled, and the quantity, it should be 1/4 in your plate, so we can ensure that our plate is balanced and healthy. And the last I want to say, the Punjabi diet, it could be very good for our heart health if we bring a balance to it, because in Punjabi diet there are changes, a lot of changes in last 3 or 4 decades. So we should make it balanced. We need to bring the balance back. So look, we should look at this plate model. And thank you very much for listening to me with a lot of attention. Thank you.
Thank you very much, Vineet. As you know, we all Punjabis, we spend all our life around food. And if we can implement your tricks and tips to follow a healthy diet, we should try that. Now I'll invite to the stage our next speaker, who's Kashmir Bisla, who is a registered clinical counselor. She runs her private practice in Surrey. And the topic we're going to talk about that we points to us like our stress, how different parts of our life is affected by it. She's expert in that, and she's going to shed some light how we are going to reduce the stress in our life and make a better quality of life. Salutations. I wish to say thank you, first of all, for setting this program. I was not able to be here this morning. When I came here, I noticed there are more than 200 people here participating. I felt really happy. When I look at my own community, they come and join these programs. They should be here to learn, to participate, because these programs are designed for you. And if you don't watch it or online or in person, so I thank you for participating. First of all, my Punjabi is not that great as Green's, but she spoke very well in Punjabi. First of all, let me tell you something about myself. I'm a registered clinical counselor. And sometimes we don't know what exactly it means. Clinical counselors work as we talk to people, using talk therapy to help you. Our work, our job is to help you with your mental health. So, our mental health is what we think, how we think, what things affect our life, and how we can correct those or amend those. Oh, sorry, I forgot this. What we're going to cover in a little bit of time. I know you had a lot of information this morning. You heard about the heart, and Vineet told you about the food or the diet, and I'm going to talk about mental health, what exactly it is, and how does it affect your heart. So, what are we going to cover? First, we're going to see if there is a link can we say if there's a link between stress and heart disease? There are a lot of research done on this. Second thing we are going to cover is what can we do to, people are really stressed, life is too busy, they don't have time for exercise, just going to work in the morning, then coming back home. So we're going to look after that. Second thing we're going to look at, how do how we, when we feel anxious, how it affects your heart. I'll try without screen, without looking at my notes. We'll start, and they will fix it. We're going to look at if there's a link between mental health and heart disease. And I'm going to answer you that question. What do you think? Is there a link between that? How do we think and what we think? What we think, it does affect. It does affect. How does it affect? How it affects our body reacts how we think. It affects our blood pressure. It affects things, inflammation, swelling. There are a lot of medical things. I said I'll start with the brain, but there are a few things that affects it. We can't say one thing doesn't affect the second thing. But what is mental health? We hear about it every day, on the radio, TV. What is it? Take care of your mental health. What exactly is it? It is, your physical health and mental health, that you can keep that in line. When you don't keep it in line, what effects do we get? We lose energy, we are unable to sleep at night, we start eating less, or we start eating wrong things. When we are stressed, we make bad choices. There are other mental health issues with that. We think about somebody had a depression, he's very anxious, doesn't get out of the house, or PTSD, had some sort of trauma, and they had some effects of that. Then I think about it sometimes. I don't want to offend the doctors, but when our leg is hurting or it's broken, we go to the doctor right away. The doctor, I have this problem, can you fix it? I've been doing this for 25 years. Still, I teach people, and when people emotionally, psychologically, they have issues, we have certain feelings, depression or anything, why don't we talk to somebody? First of all, we keep it as a secret. We don't want to disclose it to anybody or share it with anybody. But sometimes that makes the situation worse. As I said, sometimes we go to doctor for physical issues. You can also seek help for mental issues as well, for depression, anxiety, and issues like that. But I have also seen nobody teaches us that easily, how to deal with our emotions, how to handle it. We mostly listen to this, we hear it, keep it inside your house, don't share it with anybody outside. But I want to tell you that if you share with somebody, there is so much help available here. When we had lunch break, some participants came to me, and I want to tell them any type of health you need, you can get it here. And you just have to ask somebody. And if you say, I don't have any help, but there's all sort of help available, we just need to get out and ask somebody. So we need to change that. The mental issues, we don't talk to others about it. So the issues, if we talk to therapist, counselor, we can go talk to them. If we cannot afford to see a professional, there's another way out. We can talk to our peers, the family members. We should have somebody that we can completely trust and talk to. The person who can hear us out properly and who doesn't pass judgment on us. Like sometimes you feel somebody, when somebody's suffering, they think such and such person is going to judge me. They're going to think of less of me, and they're going to divert it to some other way. They don't want to show themselves as weak. We want to show ourselves as strong. We need to change that stigma. We have talked about emotions. What can we do to manage our mental health? There's so many things. As you came today, we call it community. With your own community, you came to learn. It's Saturday, you're spending whole day here. You could have gone somewhere, but when you get out, you meet somebody. That is also a factor that helps us, our mental health. You know, not here. In England, there's a whole ministry for loneliness. They know some old people, they feel lonely in their life. The kids are gone to work, grandchildren are gone to school, and then seniors are left alone. They formed a ministry how to help the seniors, how can improve their mental health. So you might have heard that so and so wife died, husband died, then pretty soon after they died as well. But I can say it's a broken heart that can also kill you. So that's why mental health is important. When we don't look after our mental health, sometime we go into a dark place. You start thinking about suicide, or you don't want to live anymore. Life is not worth living. So first of all, spend time with positive people and share your feelings. Don't feel lonely. There are always programs at the Gurdwaras or senior center. There are so many different ways. And it's also important to enjoy your life. Don't think that, I have this to do, I have to do this. When we're sitting here, but we're thinking about something else, once this is done, I need to do this and that at home. But we need to look at wherever we are, we should pay our full attention with mindfulness to that moment. We're sitting here. Nothing else should come to our mind. We should enjoy the moment. We should just enjoy that instead of thinking about something else. How else can we improve our mental health? We can do some volunteer work. They say people who volunteer even week or 2 hour or 2 hours in a week, it affects them in a better way for their mental health. When we volunteer, we know, then somebody's waiting for you, and that I'm going to spend some time with somebody. That helps them as well. If you're active, you should join a sport, play tennis, go swimming, and later on in your old age, you can go like ride a bike. Doesn't matter the age. It's good. What else can you do? You can look at your lifestyle. How can you make it better? Not to smoke. If you drink carefully. And there are 24 hours in a day. At least 30 minutes a day. Find for yourself. When you're sitting all the time at a chair or watching TV, every half an hour or so, get up, move your legs. If you can do it, you can walk 30 minutes a day. That's the best exercise. You don't need any special equipment to do this exercise. Just need good shoes and walk, look at the weather, go to the park. If you start walking 30 minutes every day from now on, It will help you so much, your mental health, your physical health. And I talked about TV, laptops, screens. There's so much on. If you can reduce that, that's also better. Because you're spending too much time instead of screen, we're just sitting. We don't stand and watch TV or phone. We're just sitting. So we should try that as well. Then when we're using these devices, use it moderately instead of, sitting in front of TV for 8 hours. Spend time with the family. It's very important as well. To find that time, make healthy relationship. That's also very important for your mental health. Proper nutrition, we talked about that. Make good food choices. Maybe you don't know that our oral health, brushing, flossing, it's also important for our health. That helps us. Brush in the morning, brushing after eating something, and before going to bed at night, brushing, and that affects it as well. Drink a lot of water, drink it as much as you can. Go to the doctor. If you don't have any issue, that's a good thing. But at least once a year, get a complete screen done get a checkup done from the doctor. And then also look at your family history. In your family history, what illnesses or diseases you have, what you can do to keep yourself better. You can learn so much from your family history as well. Sometimes, there are bad times in life, but, you can always deal with that bad time. Somebody just sent me a message that you got only 4 minutes left. Meditation, yoga, doing prayers. These are very simple things. If you enjoy it, do it. Take deep breathing. Some people have cats or dogs, pets. It's very important for your mental health. You don't feel lonely, and you have to go outside with them if you have a pet. And empower yourself with knowledge. Learn whatever you can. And maybe somebody else already explained. Some people think, my body is not well. So if your stomach is hurting, there's pressure you're feeling at heart, if you have any feeling, if you're tired and you have more stress, don't ignore it. Sometimes you learn about this later on. Somebody got a heart issue. Okay, no, we'll talk about questions later. And lastly, even if it's diagnosed, if you have some issues, health issues, you don't need to worry. As I told you, what you think, it affects your body. So if you have been diagnosed with something, if you have any heart issues, seek help and improve your life. There are so many different ways to assist you. And sometimes that happens in the family. Sometimes we feel stressed about that as well. Looking after somebody, father and mother, we have to spend so much more time, but we need time for self-care. So overall, I'll just say that we have learned there's so many different connections. Our body and mind is connected, and we can always make good choices for our life. And you can start it from today. Think about it. Today is your first day. You came to this forum. Whatever you picked from here, even if you apply these one or two things in your life, it will change a lot. So our mental health, that to seek help, don't feel bad about it, don't feel embarrassed. It is there for you. and find some, just don't think that only you have that experience in life. Everybody goes through stuff like this. The research tells us that everybody has depression or episode of depression in their life at least once. So everybody in the world goes through this, so there's a help available for it. So the good thing is the help is there. We just need to ask somebody to get that help. Thank you.
Thank you very much. Even we were having a technical glitch. Still, you still explained mental health very well to our audience, and you emphasize that the mental health is very important, and we're having a good lifestyle is very important. Our next speaker is Dr. Guljar Chima, who is a family physician. Dr. Guljar Chima, 2001. So he presented the Surrey Panorama, June 5th, 2001. Dr. Gulzar Chima, he became a mental health minister, and he was a member of BC. It's not only BC, but in all different provinces he served. Dr. Gulzar Chima is one of the founding directors of iCON Forum. For last 12 years, Dr. Gulzar Chima are connected with iCON. Right now, Dr. Chima is a family physician. He is practicing in the Department of Family Department in University of British Columbia. So I'll request Dr. Guljar Chima to come on the stage. Thank you so much. First of all, I don't have the slides in front of me, but I'll try my best to use them properly. It's like sitting it in my office, and I'm sitting with a patient in my office. I'll try to explain things to you the similar way. I'm beside being a doctor, I'm a full-time volunteer as well. Whenever they need me, I'm there. So the program we from last 12 years, they have seen live this program 50-60,000 people that we have established in UBC. They are funding, and then all our children who are working there are learning. Their Punjabi is getting better, and they are serving in Punjabi, so they are getting better. I think it's working now. So it's okay. I'll try my best how to do it. First of all, I I take my glasses off. What is heart disease? We go to the family doctor for our illness. So we say I have a heart disease. The basic in basic language, any function of the heart, blood vessel defective, or the blood is not flowing properly. Is it okay or not? Are you there? Okay, it looks like my luck is good. What is the definition of heart disease? If there is a problem with our blood vessels or when it's beating, why you are ruining my program? Let me do it on my own. You just shut it off. My speed is not that great that I can cope with it. Any problem in your heart rate problem, if your heart is not functioning, if it's about blood supply, any problem with the heart it is called heart disease. The main thing is why there is a heart disease. What are the causes? first of all, if your cholesterol is high, your blood pressure is high, your blood sugar is high, and if beside that, if you are smoking or excessive use of alcohol, it could affect your heart. Leave leave the slide out. We are all um, simple people. They will understand what I am talking about. First of all, when you go to the doctor, he will do your blood test. Then he will tell you to check the blood, check the sugar, check the cholesterol. This is the first thing he will tell you to do. It's normally present in our body. There are two types of cholesterol, LDL and HDL. And the good cholesterol is HDL. It's good for our arteries because it maintains our arteries. Like, just like every part of our body needs a blood supply, heart is the one supplies blood. If the bad cholesterol goes up, then our arteries get the arteries that supply blood that get clogged. When your doctor is going to tell you that your cholesterol is up, the if your whole cholesterol is less than 5, if your LDL is, and ask about good cholesterol, bad cholesterol, if there is anything wrong with the cholesterol, then that means you might have a heart problem, so that the doctor will prescribe medication for that. Just because if you cannot say that after 1 week taking medication you are doing okay, you are well. It takes 6 months to a year, and the patient has to be on medication for for the rest of the time. One thing that we should note, and everybody says my diet is good, I don't have any problem. Why my cholesterol is up? You should all know our liver produces the cholesterol, but it's the liver that produces the cholesterol. But the diet factor is very um, little effect on the cholesterol. But the worst thing is sugar, the blood sugar. Every fourth person in our community has the diabetes, type 2 diabetes specifically. What is type 2? Naturally, our body stopped uh, when glucose is increases in our body, when our insulin is not working, and then it start damaging our blood vessels. And then with the combination of cholesterol, diabetic patient, and their heavy weight, or who are using excess alcohol, then the chances of for heart disease is more for those. So that's why whenever you go see your doctor, your family doctor, let's check your blood sugar. He always tells you. So the 3A1C, the most it has should be 7, but preferably below 6. So continuously your sugar in the body should be right. Next thing is blood pressure. What is blood pressure? Yeah, so our heart is not, our heart is pumping the blood to the body. The upper blood pressure and the lower blood, systolic and diastolic. That blood pressure, the normal range is, most of you who are here, it should be 140 over 90, about that. The two or three things are very important when you go to see your doctor. When you go, if you have eaten well and the blood pressure is, you can go to a pharmacy, you can check your blood pressure, you can, but there is a way to check blood pressure. There should be a proper instrument, and how to use it you should know. Then it's very important to pay attention to that. There are blood pressure machines in the temples, gurdwaras, pharmacies. They will tell everyone that you have high blood pressure. So it's not that you check it once and you are diagnosed with high blood pressure. It's very important how you check it, where you check it, when you check it. Why blood pressure goes up? If you have higher sugar in the blood, then you will gain weight. In our community, s- our weight is genetic material is different than everybody else. So the combination of weight, because excessive food, excessive alcohol, not managing stress, not managing health, not managing cholesterol, not taking medication, and even with taking medication, not taking precautions, these these things are very risky for our health. So the most important in my 45-year practice here, we prescribe the medication. It's expensive. They, there is no and there is less income, and they don't buy the medication. So try your health is very important. The medication for blood pressure for your health is very important. So you manage all these things. So we can buy a ticket to go to India every 6 months, but not the medication. So the people who are excessively drinking, if they can buy the alcohol, buy the bottle. So these are very small things you should, but it affects your health. You must have noted people have arthritis. There is inflammation, swelling, different types of inflammation. Those people, some then they also have heart problems. Some of those patients. So the big key points I will share with you. First, we were thinking about smoking. We thought our people don't do smoking, but now we know the older generation is doing it. The new coming generation is doing it. It affects body really badly. I was reading something else. The environment, the pollution, very small particles in our environment, pollution, it goes into our lungs and it goes to our blood, and they are damaging our heart. So when you go visit India, you are all right, and then you have problems when you go there because the pollution is very risky for your health. Before there was no heart issues. I was repeatedly talking about excessive drinking of alcohol. There is no energy in it. It's n- n- so if you are drinking in the morning, in the evening, no use of that. People who drink, some people say, I only take one beer. It, you drink beer, wine, 2 to 4 ounces. I drink that affects the body same way. It damages the liver, especially 5, 7, or 10 drinks take daily is very risky for them. If you talk to a patient, how much you drink? He will say, I didn't drink all my life, just like a medication. But that's just you have to make a firm decision. You have to make a determination. If there is a mental health issue, the solution is not the alcohol. Then you will feel actually more depressed. The key part is the heart health is your diet, how much you eat, how much you need, 3 to 4 times, 5 times more excessive eating, how much carbohydrates, how much fat, what kind of fat, which butter you are using, how much you are using, how much activity you are doing, how much time you spent in front of the TV, how much time you spent outdoor. These are all the things that affect your heart health. As long as if you don't manage your diet, nothing is going to help. The more the bad habit we have, the worst habit we have, they will spend time. But when you do the grocery shopping, 15-20 minutes later on, they will buy the groceries and come back in the parking lot. No, you don't read the labels, what you are buying, where is the expiry date, where it came from, how many times it's sitting in the store for how many months, where it was, how much sodium, how much potassium, and so all those things should be kept in mind. So then otherwise it's not gonna, otherwise it will be risky to your heart. So there was one time, 50, 60 years ago, no movies you were watching. Everybody was fit, physically fit, active. Food is the was not that amount of food was present. Everybody was taking small amount. The food production increased, and then we are excessively eating, and inactivity is high now. So we gain weight, our blood pressure goes up, our sugar levels go up, stress increases. So to avoid all these things, 30 to 35 minutes at least, 5 or 6 times go for walks. Sometimes people say I'm doing so much exercise, I go to gym. If you go for to gym for 10 minutes and excessively eating, then there is so many wrong conceptions in our mind that on weekend we eat excessively, drinking, eating more, all these things. These are very important things. There are a lot of things that is not good for your health. If you up, if you take care of your heart health, is very important. You you yourself, your family doctor. So just see one doctor. You don't have to see three doctors. Counselor, you can see, you can take advice, and once they tell you how much function your heart is performing, this much your sugar levels. So to maintain those things, just prepare a file in your house. Before it was not needed, but now it's easy. The family doctor can give you the report, check your sugar, check your cholesterol every 6 months. See, see your eye doctor, see cardiologist, get your eyes done, because if there is a cholesterol, it will also affect eyes. All these things, because without heart, your body cannot function. So the health heart is very important. So all these factors are in your hands. Take charge of your health. So family history also affects heart health. So if the rhythm, the heartbeat, there are specialized tests, specialized services are available. So like you are all sitting here. These are the simple things, very common things. So keep in mind all these things. Maintain your heart health. So exercise on time. Watch your food. Go talk to family doctor. Don't excessively eat. It's a complementary medication. Ayurvedic, homeopathic approaches, they don't hurt as long as you consult it with a family doctor. They are not harmful as long as you talk to. So if just to check if there is no interaction, whatever medication you are taking with these other. One thing I want to mention, when you travel to India or Pakistan, whatever your doctor worked for, don't waste it. Take your medication, take your prescription, and don't. If somebody says a Canada medication is not good, or it's not, it's practical things. Don't change your medication when you come back here. Bring your go see a doctor, see a pharmacist, talk to them. And along with that, if you are suspicious, if there is a problem, talk to your family doctor, consult your family doctor, Don't go to. So it's a spiritual role with the spiritual people going to play. They're not gonna fix your heart. Just take care of your heart from beginning to end. As long as our heart is working. So these all these things that I discussed is common things, simple things. Pay attention to that, folks, and prevent from all those things I mentioned. I will answer your questions later on. Whatever question you have, don't consider yourself that I'm not going to be okay. So thank you.
Thank you very much, Dr. Chima, who provide us information because it's a chronic disease, how we can manage it ourselves, and how we live a normal lifestyle as soon as possible. Now I'll invite my next speaker, Harleen Chahan, to the stage. Harleen did her graduation and after getting clinic pharmacist degree, and she started working. Now Harleen will come to the stage and tell you how to uh, how we make alteration in our life and manage at home how we can live a healthy life. Harleen, it looks like everybody's tired by now. Honestly, so thought that you teach me. Uh, I taught you so much. Now you will teach me. We'll learn it together. You will tell me if these things are good or not. The doctors did their job, told us to do all this, and what we do as patients, what we do at home, how will we do it. We'll talk about all that today. So, in there, I'll tell you what you can do at home. How can you do exercise and control alcohol? Doctor talked a lot about that. We'll talk a little bit more. How to monitor your medications, manage your medication, check your lab results, and we'll learn a little bit of that. So we think heart disease, or there's so many things that there's nothing we can do about it. One is age. As we are growing older, it affects your health. But there's some things you can't do anything about. But there's some things you can do about it. High blood pressure. Can you do something about it? Cholesterol. Can you do something about cholesterol? Diabetes, sugar. Can you do something about that? Can you do something about exercise? Can you do something about the weight? So there are a lot you can do. You can do something about age? No problem. But we'll do rest of the things. Why I'm saying this, that we need to manage our health at home. As I said, when you go to the doctor, they'll have the same information that you provide to them. So if you don't check your blood pressure at home, then you go to the doctor and ask them to check the blood pressure once. Will that make any change? Will that help? So if you're checking your blood pressure at home, then you go to Dr. Chima. You can say, my blood pressure was like this during last week. Do you think it will help Dr. Chima a little bit? Same thing about diabetes. If you check and tell him, they can do something about you. There's one thing they can cheat. That's A1C. A1C is doctor's method. If you're lying, they are going to check if in last 3 months what was your sugar level. Then they know. There are red blood cells in your blood, and then those cells, they stay in your body for 90 days. And those blood cells are so smart, and they say we like sugar. that sugar gets stuck in your blood, and then you tell your doctor everything is fine, and then they check A1C for last 3 months. The blood cells are telling him that you're lying. So that's why A1C they do that, because when you're not checking it every day, some people don't need to check it every day because they know, so they can know how much glucose is in your body. That's why A1C is important. Before we talk about anything else, I want to tell you, we used to talk how much alcohol you can drink. The answer is there, but you tell me your risk of heart disease. If you don't drink, what will be your risk? 0. Then there will be no risk. They used to say that you can have 1 or 2 drinks a day. They have changed it all now. The new research showing that in a week, if you have 1 or 2 drinks, that you have less of a risk. Remember, if you don't drink at all, that's the least risk. If you take 1 or 2, that's a little bit of risk. More than 3 drinks a week, more risk. Why they're saying reduce it? It affects your health. And second thing is alcohol has effect on cancer as well. If you drink more than 3 drinks a week, your cancer risk also goes up. Not just in men, it's also in women as well. That's why they changed it all. If you drink more than 7 drinks a week, it affects your heart disease, and also affects your brain. It can cause you a stroke. Where does it come from? It's not like how many drinks you're going to change today. That's why they changed it. Second thing, we have talked a lot about it, about physical activity. We're talking about exercise. So many people told us today, if you want to do exercise, that 2.5 hours in a week, from moderate to vigorous, that will, your body should feel it, that you should force yourself. So 2.5 hours a week. If people are asking what does it mean, so the moderate activity we're talking about, meaning exercise. What does it mean? That your heartbeat should go up. You move around a little bit, that you feel that your heart is beating faster. And second thing is rigorous activity. That means more powerful exercise. When you're running, that's what it is. That's vigorous. Then they say aerobic. Aerobic means that affects your breathing. That you have hard time breathing. So many people say, how many people go for walk, and how many people when they are walking, their heartbeat goes up. If it does, that means you're forcing your body, and they can still talk. That means they're not moving fast enough. If you can talk, you're not moving fast enough. Now, how can we do it? So your physical activities guidelines that are showing that at one time when you're doing exercise, it should be at least for 10 minutes, minimum for 10 minutes. It can go up more than 10 minutes, but it should be 10 minutes where your heartbeat is going up, and you're having hard time breathing, so having hard time talking. Sorry, it should not increase it all of a sudden. It should gradual increase. It's not like you go today, like go home, start doing exercise, running, when you haven't done anything for the last 6 months. So every day increase a minute. And we're talking about aerobic exercise. Aerobic exercise, where you have hard time breathing, it's good for your life. Then your heart is doing some exercise as well, and so your whole body can get blood. Second thing is that's very important is that is to make strengthening exercise. What is strengthening exercise? It's better for your joints, your bones. Those are the exercises when you're doing up and down the stairs. When you're lifting something heavy, do yoga. Why is it important? When we haven't used our body for such a long time, and all of a sudden, if you start running or doing aerobic exercise, it's hard. You need to make your joints powerful more. People like me haven't done any exercise 6 months, then they all of a sudden they do too much, then they're hurting and they don't do anything for a week. So it's why important to do strengthening exercises, stretching. It's very important. So you can do it all together. But when they say 2.5 hours a week, that's for the first time, you should have hard time breathing. There's so many questions about blood pressure, how you check it at home. How many people have blood pressure machines at home? How many people check it at home? A lot of people do. Okay, they're mahar. They're experts here. How many people check blood pressure after drinking tea or coffee? You don't. Why not? It goes up. I mean, I told you there are so many experts here. Second thing, if you go down the stairs all of a sudden and you're still having hard time breathing, should you check your blood pressure? Why not? It goes up. If you're wearing tight clothes, should check blood pressure? Why not? If it is already tight and you put a machine on it, it will go up. So what are we saying? If you have eaten anything or drink anything, stop, sit down for 5 minutes. Your clothes should be loose. Then you put your blood pressure cuff on. How many people check blood pressure? They start yelling at each other. Don't talk. Because when you talk, blood pressure goes up. And last thing, when you're checking blood pressure, your arm should be next to your heart, like this. It should be at the same level. You can look there on the photo. Don't cross your legs, right? Keep your legs straight and keep your feet on the ground straight. That is the way to do it. How many times you need to do it? People ask that. It's up to you. You can do it once a day, but do it same time every day, right? That's all it's showing there. Before I go ahead from blood pressure, some people must be taking blood pressure medication here. These medications will work if you take the medication every day. If you stop taking medication, your blood pressure can go up. But sometimes blood pressure can go up and down. If you are sick or something, blood pressure can go down or up. You can talk to your family doctor about that. But if you think that with the medication you're feeling dizzy, you're not feeling right, and you started a new blood pressure medication, you must talk to a family doctor right away. Don't wait. Maybe your blood pressure is too low. So before changing your blood pressure medication, you should talk to your doctor. And second thing, when they go to India, they take medication from there. The combination of their blood pressures are different than here. Dose is different. The combinations, sometimes 3 4 medications are together. There's so many different medications that are available there or here. I'm not saying those medications are better or not. But if you're getting medication from India, and here, once you start taking new medication, make sure you tell somebody. So if your blood pressure goes really down, that's not good either. It can affect your heart, right? Now I'm going to tell you quickly about diabetes. First of all, with the diabetes, some people check. How many people checking blood pressure at home? When you check it, blood sugar, there are two things: before eating, after eating. Because after eating, it goes up. Then you can keep record of it. You know when sugar goes up, what you do, but we don't know what we do if it goes down. If your sugar is below 5, don't drive. And if it is below 4, and you're not feeling well, fine, and you're sweating, and you're trembling, your heartbeat goes up, check your sugar level. If it's below 4, you need something. You can give yourself milk, you can give yourself glucose, 15 grams, take some honey. You can put sugar in your water and drink it. If it is below that, take all that, check after 15 minutes, and then you need to eat something again if it is below 4, because you can lose consciousness, have seizure if the blood sugar is really low, right? We don't have time for this. I want to tell you about your heart medications. This question came this morning. If you have stents in, even if you don't have stents in, you had a heart attack or fibrillation, oh, the heart rhythm is not fine. Then they give medication to thin your blood. So blood thinners are prescribed. Aspirin, there's one, warfarin, could be on warfarin. There's a new one, Liquiz, Pexaban, Rivaroxaban. Those medications are fine because they need to thin your blood. One thing you can do yourself at home, if your blood is very thin with these medications, and you can have bleeding anywhere from your body. How will you know if you're bleeding at home? No. If at home you start bleeding all of a sudden from somewhere, go to washroom and there's blood in there. And if you go to washroom and if you see dark brown spots, that means that it's possibility of bleeding somewhere. Don't take this lightly. If you start seeing blood while passing, urinating, tell your doctor or go to the hospital, right? Otherwise, you can take these medications, fine? I'll leave this. And there's one more thing I need to tell you about medications. What happens on January 1st every year? You pay for all your medication. Why do you pay for it? Because you're enrolled with Pharmacare. It's good to be enrolled with Pharmacare. It's a program of government that covers your medications. How does it cover it? According to your income, based on how much you make. Pharmacare, as you pay taxes every year, every January 1st it changes. So what happens? We go to the pharmacist. Last time it was covered, this time it's not. The reason for that is, it's based on how much you earn a year. Your deductible changes. What does a deductible mean? Deductible means, how much money you make in a year. Based on that, you have to pay every year. So if you have to pay $100 from January 1st, if you don't pay $100 up to that moment, your medication is covered. If you notice it's January 1st, you have to pay something, that's a reason for it. If you haven't filed your taxes this year, your pharma care can end. It's not pharma care, BC services. Yeah, everybody gets it. Some people don't have pharma care. You can check with your pharmacy. Do we have pharma care or not? So you know your medication is covered or not. So check with your pharmacy for sure. That was the last thing from me. Digital tool, I talked about it earlier. Within this time, that's all we will talk about, right? Okay, I'll end it. Thank you.
Thank you very much, Arlene. So, Dr. Chima, first question for you. The question is, the medication are given after the heart operation. How is linked with the dementia or the or Alzheimer? The medications that are given after the heart operation, is it linked? Is it linked with the dementia or forgetfulness? No, there is no link. If you are already have early dementia or depression, then it could happen. So we are all are in confusion. The blood in our body, cholesterol, sugar, or the other things that those things that are reason for stroke or heart attack is not only affect the heart but it affect the whole body. So overall, you have to manage your health in this country or any other place. There is no doctor who can prescribe the medication that could be that could damage your health. So take care of your health. Yes, is healthy approach is very important. There was there are billions of people who don't have doctor, they are managing, so you can manage. We are depending too much on the system or on the on the doctor, and that's damaging. The next question is for Kashmir ji. The question is, if there is so too much stress, so how it affects the heart. In the presentation we agreed whatever we think, it affects the whole body. When we are stressed out, we know on our heart and other organs get affected. There is a connection. So we also talk about what we can do to manage our life more. So if we change few things in our life, we can slow down our life. Or if there is a issue, we can go talk to someone, and it really makes a difference. Thank you. Next question is for Vaneet. This question came many times. How many times we can have tea during day? Okay, because the answer to this is lengthy. So please give me that much time, and if I go over, let me know. People who don't know what is a registered dietitian, I tell for their information, registered dietitian. They are part of Canadian healthcare team, and our training, our education is a different. It's about holistic health and diet, how they are linked to each other, how they're connected. That's our expertise in healthcare. If your questions are related to that or any diet, then you can talk to the dietitians. Dietitians are present in public health. With the healthcare department, they work with them or privately. So you can talk to dietitian, because how much tea you can drink, it depends what you put in the tea, how much what percentage of milk you are using for your tea, how much sugar you are putting in, it depends on that. Other than that, our science it doesn't consider tea a bad thing, but if we are having it several times a day, so what material, what things is replacing our diet? So that will affect our health. What tea is replacing in our diet? If you're drinking 2 to 3 cups a day during in the morning and didn't eat breakfast, so the balance in your diet cannot be achieved because you missed a meal. Sometimes we drink tea and miss the meal. That will affect your health more. That's why the question how many times you can drink tea, the answer varies depending on your lifestyle, age, diet. But if you want a short answer, I would say that the tea in our culture, we only drink that time when we sit down and we speak from our heart. We share our things. If you have chances, if you are getting chances just to lighten your heart, talking about things, then, but if you are drinking tea because your life is so fast and you cannot avoid it, then and the other things like energy, nutrition, sleep, health, you should be careful about that before talking about tea or decreasing the amount of tea. I hopefully I answered your question. The talking about tea, do read the history about tea, 150 years old. People, countries, people drink tea. It's not an issue. It's a kind of antioxidant in the body, but we shouldn't we talk about that. But the addition we make, sugar and milk you put in the tea, that's the one. If there is issue about intestines or stomach ulcer or something, but avoid the hard, like the one is very much boiled, and avoid that. But if you take tea 2 3 times, it's a social kind of thing too. If you are read the Indian Punjabi history, the colon cancer was very rare because everything was diet based. So don't worry that much about tea. The main issue is everything else we do. Yeah, how much you are eating, what you do, how if you eat laddus, gulab jamun with tea, burfi, and then you bring pinni in then the relatives are here. We're not going to stop them from eating. In Surrey, where we are living, look at the shops. Whatever, did you ever ask what you put in these sweets? Did you ever ask? Go ask them. It's not about only tea. How how many calories in one rasgulla? 350. In one gulab jamun, 300 calories. Do exercise, walk, but if you eat two laddus, it's all gone in the drain. So these are the practical things. We are very simple people. So we should be straightforward. No excessive amount of money is also dangerous. One thing you need to remember is whatever restaurant you go to and eat food, I'm sure Vineet will agree with me. Do go see their kitchen, how much is clean, how much they are frying the pakoras in that oil. So all those things very important, crucial. So your doctor, your dietitian is all the specialists, whatever they're doing, do because you are not managing your diet, it goes into drain. Whatever work your healthcare professionals do for you. Look, it's not that we are thinking that there is a profession. You come to my office. If there my it's not clean, So if you are going to a restaurant, have the it's not clean, how you can manage? You go if you go to somebody's house, the washroom is not right, or it's not good hygiene, is smelling. It's not the you have to protect yourself. It's not about that person's personality or anything. Not that anything that's available and you eat it. You are paying for it. You tell them, you ask them, they will be embarrassed about that. Like, wow, how you make the sweets? Look, acid is important for the body in our saliva. It's very important for the absorption. We cannot stop it, but how you manage it, it depends on your aztec food, citrus fruits, oranges, all these categories. Avoid them, reduce it. I missed the talk. You should eat whatever you is comes in your fist. Yeah, eat according to time. The SAT. Our people are in a lot of confusion. It's only our diet that's responsible, and where we came from. There is a bacteria in the water. It it sits in our body and it gives us so much. I don't have time to talk about that because I was late. I didn't hear the whole conversation, whole talk. Control your eyes and your hand, and you will have a good health. I request to those people who send the questions in the morning, they are waiting for it. And if you can, I can please ask those questions. It's from the morning, this question. Silent heart attack. What is silent heart attack? There are blood vessels, there is valves, nerves. Why we feel pain? When the blood is not reaching to heart, the muscles start shrinking. So that's why you feel pain. Silent attack is when our nerves are not working. Whenever you are diabetic for a long time and you don't know if you actually have a problem or not, the common presentation is not a chest pain that we feel problem, shortness of breath while walk. While I go upstairs, I feel shortness of breath. Then you don't know silently is there is a problem going on in the heart. Silent means you don't know what is going on in your body. Diabetic patients, people who are with high blood pressure, with high cholesterol, whenever you feel shortness of breath, whenever you feel shortness of breath, meet your doctor, get the test done before we do where we're doing ECG. There is no point. Just go for a stress test, go for a scan, and then there is a confirmatory test, angiogram. It's called angiogram. There is no point of going beating the bush. The thing is, if you have excessive cholesterol, excessive sugar, excessive body weight, and if you have problem, then this is silent attack. When you don't know, it's not a magic. It's our body. Its presentation is like that it will not let you know. Next question. There are two questions. One question is yeah, the cashew, walnuts, triglycerides are more. Is it un- damaging? If one person is eating one egg per day, is there an issue regarding the cholesterol? And there is a myth about this question. Nuts, triglycerides. There are no triglycerides in the nuts. Triglycerides are in our body. There are things that increase those, and there are things that reduce. If we eat sugary food, anything we eat with sugar, then if you eat the peanuts where that are coated with honey or sugar, then we have to be careful with the glycerides. If you wanna lower your triglyceride, then consult the guide. Then eat nuts. HDL are present and they will help you to reduce your triglycerides. But how much? Whatever, that's the handful, like in your fist, and like not like we are eating cashew burfi, mm, dry roasted without sugar, without salt. 4 5 almonds or cashew or walnuts. So these kind of things you can eat. The second question is about the eggs. Before there was a myth that the eggs have cholesterol, but the new science and evidence is you can eat eggs. That's what it says. Though you don't have to worry about your cholesterol, like how much eggs you eat. Uh, so maybe one egg a day, 7 eggs per week is moderate, and you can eat it. The next question is for Kashmir ji. If you want to see a counselor, how we can see a counselor? Do we have to go to doctor, or how we can see a counselor? Is it free to see the counselor? You online, you can go online. BCACC, our association, but those services are costly. You have to pay for it. But when you are working for some business, you have extended healthcare benefits. You can get your death, you can buy glasses, you can clean your teeth, you read your package, mental health services, to read that if there are mental health services present. Sometimes you have to pay from your pocket, and then the counselor give you a seat, and then you can claim, you will get reimbursement. If you don't have that, and if you can't afford that, so then you can go to community services. They are low cost or free counseling service. There are available in the community health, as I told you earlier. So you have to advocate for yourself, and you have to research, and you will get a service from somewhere. The next two questions are for Dr. Chima. Home is about home remedies. What are the home remedies? Are good? Are they good? The second question is, and the medication, the
Allopathy,
allopathy and
homeopathy.
homeopathy. The people who came from India or Pakistan, we are mostly Punjabi. 60, 70 year before, did you hear cancer? Somebody dying with cancer or heart attack? All these things we are doing. We whatever we learned from culture, lentils, garlic, ginger, spices, all those things are very important. So considering all these things, in the Western they modified it, gave new name, our spices. For example, garlic, it blood controls the blood pressure, cholesterol, and anti-inflammatory things. Turmeric is there are capsules, and it will improve your joints. They are very important. Everything in moderation. Second question is also related. If you have heart problem, you are taking aspirin, you are taking turmeric, and your blood will be very thin. Don't just hide your medication from your doctor. Tell them, these are the things I'm taking, these are the medication I'm taking. Pay attention. The homeopathic or Ayurvedic medicine doesn't hurt you. No, it will not affect anything. Is for your prevention is very important to maintain your body. The second thing is people who have less money, people who are in South India or on near the coastline where the weather is good, environment is good, they use all these kind of spices. They are very healthy. They don't have heart attack. their complexion is good. So all these things. So our culture, our civilization, our medication here is acute care medication. You tell your doctor you have heart attack, and you will have a you have an operation, but your dietitian is going to tell you what the things to eat. Before the diet was Mediterranean diet, there were many names here for the diet. The Punjabi diet, spices, uh, all those things are good. And there are fights in the world because of these spices. The spices are very important for you. So take. Do you agree with me? Yes.
We are all trained. We go to the doctor, family doctor, specialist. They don't have answer for everything. A psychologist, dietitian, talk to them. Somebody who can coach you spiritually. If you go to the church and just pray there, that's not gonna help. Do some yoga, do some deep breathing, hot yoga. Avoid that. Yoga is fine, but sweating excessively, excessive sweating is not good. You just have illusion that's they're taking your money. Uh, Sweating is to maintain your body temperature, to keep it cool. So do yoga, do exercises. Spices are important. So good quality spices. Would anything you want to add? Yes. I just want to say the real medication is your diet. Even in Western medication, or even say in Punjab, the balanced diet is important. The healthy eating, that's best preventative medication. If we bring some balance to it, eat healthy, then we can keep our health healthy. But once you need Western medication, then you should consult your healthcare team. There are many professionals in your healthcare team, and they can give you the best advice what to eat. Based on your medication, they can decrease the side effects of the medication and make it more effective. And we should add that into your diet when you're taking medication. There's so many foods that you should not be eating because they interact with your medication. So if you don't have any illness or disease, then look after your health and eat what's good for you. And if you have a disease, then talk to your medical team. Tell them you're trying these remedies. And the medicine is holistic these days. They can give you advice that according to our science, this is better. That going to eat more or less, or should you eat more or less? The nuts, the lentils. Dr. Chima, three more question. Then one more Kashmir, then one from Eid. First question: if somebody is has excessive breathing, or they're having hard time breathing, is it lungs issue or heart? People who have asthma, they have different issues. But if you have diabetes, cholesterol, and you're having hard time breathing, especially going up the stairs, that's a big sign that you should see your doctor. It's not a minor thing. If you're having hard time breathing, going up the stairs, that's a big thing. Oxygen is not going to your lungs or your to blood. So, it's your lungs that check your heart. And asthma medication, use it properly. Talk to your pharmacist. It's not just you just go and say hello and get the medication. And to use the pumps, how to use the pumps properly, how many times you need to use it, pump or anything else they give you. Second question, I see. Second question is, if you're walking and you have shoulder pain, and if it is going on for 10 minutes, for so many years that you have this problem, should you see your doctor? It's a very simple answer. We should understand the shoulder pain and walking has no connection unless it's on the left side. Move your body, be active, some strengthening exercise there, as they mentioned. You're going to get well. No, you're not going to get well yourself. If somebody is diabetic, their muscles, I'm 70 years old. If I'm not walking, I'm going to get sick. The muscles are not going to move themselves. You need to move it and move your joints. And when you're moving, exercising, it's using sugar. It's a simple things you should pay attention. It's not doctor's job, it's your job. Last question for you. If somebody had a bypass, but their feet are really dry now, again, somebody had a heart problem and they had a bypass, they're diabetic. Do you think it was heart block? The blood goes all over the body and it goes all over down there. The veins, the blood vessels, everything affects it all the way to the heart and to the feet and other organs, sexual organs. It affects everything. And if somebody has a health problem, had a surgery done, and they're getting swelling, and then they need to control their circulation. When you say go sit at home, don't sit like this. Push your legs up and then improve your circulation, lift your legs, do some massage, do some exercise. Best exercise you see to push it. Move your legs and move your limbs even when sitting. Some people sitting and they're saying, give me water, give me food, give me tea. You should get up and, move around and do some circulation. Most of the people who are sitting here, they are fit. I don't see anybody who's that sick, but activity, you need to increase that a little bit. Some people say, Herline, walk, should I walk barefoot or not with shoes? That doesn't mean anything. Walk is walk. The dirt is not going to change anything in your body. And, avoid those gimmicks. Thank you. Another question for me, then for Kashmir Vaneet. I got a question. Brand name and generic. Is there any difference between some they say brand name generic? Altes or some liquids generic mix one. There's no difference. Brand name medications are only the companies that have they pack it. There are so many years per patent. They have patent for 10 years. When that patent expires, then other companies can make that medication as well. So usually brand name, generic, it's the same medication. And just to keep the tablet stable, what they put in there, that's a little bit different. But the active medication is the same. Only thing is different, insulin. Insulin, a generic brand name. It's a biosimilar. Biosimilar means the medication, the structure of the medication, if you look at it under a microscope, it's the same. It's the same medication and it's built the same, but it's not the same. Got it? Good? Thumbs up? Just want to add something. If you go to the pharmacy and go anywhere, doctor wrote it for you, Altes or any other medication, they're very expensive. You can't afford it. You have limited income. You can ask the pharmacist through your family doctor or directly yourself. Register yourself with PharmaCare, participate, your medications will be free. We get stuck in there somewhere. And you say the medication is not fine. All the medications, go get it yourself. There's no problem with it. It's the same. A pharmaceutical company, and sometimes we have a 12-year patent in India, they make it, you know, it's just up to you. You feel that it's different, it's cheaper. Cheaper doesn't mean it's not good. Next question for Kashmir. Kashmir, if you talk to anybody about your problems, is that beneficial? If you talk to your heart with somebody, does it help? Well, you know the answer to this question. What happens when we keep everything in our heart, in our mind? We don't talk to anybody, we don't share with anybody. Does it affect us or not? Yes. But as we said earlier, if we have tea with somebody, you talk to somebody, you share with them, I'm like this, how are you? Don't you feel lighter? Don't you think, yeah, no, they listen to you, you heard them, it helps you. If you take it to the next level, first the counselor, there are no counselor therapists. You just talk to somebody who's close to you. But now, if it is something serious, our friends or relatives are not able to help you, then professionals can help you with that issue, right? But everybody should have a person or two in their life that they can talk openly with. You asked a question, do you need doctor? I forgot to answer. You don't need a doctor's referral for psychologist, psychiatrist, for a counselor, but for psychiatrist, you need doctor's prescription or referral. Last question of the day for you, Nate. It's a very big question. You said coconut oil is not good. We have been using coconut oil for years. What do you think about coconut oil? The coconut oil, we call it saturated. We consider it saturated fat. The saturated fat is built in your body itself. We don't consider it fat. If we increase saturated fat in our diet, it's gonna go in there, and it's gonna create plaque in your blood. What we call metabolic processes. Your question is: there's some countries, there's some places they've been using coconut oil for years. Even in Punjab, we used to eat a lot of saturated fat, milk, buttermilk. But now our lifestyle here has changed a lot. We don't live in a warm place or hot place, and we don't work as hard. So that's why our saturated fat, we need to decrease it in our diet so that it doesn't go into your body and get stuck there and affects your heart disease. Some people have their coconut oil their whole life and it doesn't affect them, but look at what they did throughout their life and what kind of work they did. I just want to thank all the speakers that you explained everything and answered all the questions so simply and clearly. Now, going forward, there are two more door prizes that are left. So I'll ask you to pull the tickets out, and Herlene will pull out a number. And there are two prizes that are still pending. Last time somebody got a ticket, so please, I'll give you another second or two. If you're ready, you can give me thumbs up. Many people are ready. First one is 470. And from now on, we sow a seed into everybody's mind about knowledge, and they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us uh, sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PICS, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Singeda, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Indeep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.